Good morning, everyone. It's 11 o'clock, so we will go ahead and get started. I want to welcome everyone to today's Rock County Public Health media briefing. This briefing is being streamed live on our Rock County Public Health Department's Facebook page. It's also uploaded to our YouTube page once the briefing ends, so the recordings are available afterwards on Facebook and YouTube. We have a small panel today, so we will be hearing some updates and some news from the Public Health Department, and then we'll open it up to the media for questions. And just a reminder, these media briefings do take place every Thursday at 11 a.m. We welcome everyone to join in and listen to these briefings on our Facebook page. And we do encourage the media to participate and send us a request to be able to ask questions live on these briefings. So my name is Jessica Turner. I'm the communication specialist for the Rock County Public Health Department. And today I have Nick Zupan, epidemiologist, with me. And I will turn it over to Nick first for some updates.
Thanks, Jessica. So just quickly, in terms of the data that we're seeing, right now we have had 14,782 Rock County residents test positive for COVID-19 over the course of the pandemic. This is a little more than 100 new cases over the last week, and we're seeing a slight uptick in our case activity. We're averaging about 17 new cases per day over the last 7 days. So it's a little higher than the past couple of weeks. Right now, it's not necessarily cause for concern, but we're continuing to monitor those trends because we obviously don't want to see an uptick in case activity, and especially want to avoid kind of increases that we saw earlier in the course of the pandemic. Right now, we're seeing about 211 active cases out there in the community, and that number has risen a little bit over the past few weeks. So the more active cases that we have in the community, the more the virus can spread. So again, we're just monitoring these trends at this point and continuing to push out the messaging of mask wearing and social distancing to prevent the spread of the illness. In terms of people who have severe COVID illness, we had 9 patients in the hospital most recently getting care for COVID-19. And again, this is a small uptick in the numbers that we had seen over the past couple weeks. Our vaccination numbers continue to steadily increase. So just over 44,000 Rock County residents have gotten at least the first dose of the COVID-19 vaccine, which is about 27% of the total population, and 28,000 Rock County residents have gotten the full series of the COVID vaccine. So that's great. We're continuing to see those numbers increase. And especially among the 65 and older population, we're seeing strong numbers there. We have about 21,000 individuals who are 65 and older who have gotten at least that first dose. So this is about 3/4 of the 65 and older population in Rock County. And about 16,000 individuals have gotten the full immunization series for COVID-19. So that's just under 60% of that population. So good numbers there, especially with our 65 and older individuals who are at higher risk for more severe illness. The other topic that I wanted to talk about today is the variant strain B.1.1.7 that has been identified in Rock County. The health department received communication from our state partners that there has been 1 case identified in Rock County of the variant strain. And this is the most common variant strain that we're seeing in the US and Wisconsin right now. This variant strain was first identified in the UK. And the reason that we're concerned about these variant strains, especially this B.1.1.7 that has been identified in Rock County, is that this strain can circulate more easily in a population. It's slightly more contagious, and it potentially could cause more severe illness in individuals who are infected with this variant strain. Unfortunately, the way that we determine these variant strains is through a process called genetic sequencing. And this is not done on every single test specimen that is collected from individuals who are being tested for COVID-19. So what happens is when someone goes and gets a test, some of these samples that they're submitting for testing are sent to the state lab for genetic sequencing. And this is the process where we identify these variant strains. A small proportion of the total tests that are done are sent to the state lab for sequencing. So we don't know right now the true kind of burden of B.1.1.7 variant strain that is circulating in the Rock County population right now. But because there is this 1 case, it is reasonable to assume that there may be additional cases in the community right now. And so in terms of the B117 variant and why there's a little bit more concern for this variant potentially circulating in our community is, like I said, it's more contagious and could lead to potentially more severe illness in those people who are infected. What we do know about the vaccine is that all three of the vaccines that are available right now do provide some protection against this B117 variant. So that is the good news. So we do have measures to protect against this variant. The other way that we can protect this or prevent the spread of this variant is by continuing to wear our masks and continuing to social distance. Kind of the same methods that we've been using to fight the virus all along will be effective at preventing the spread of this variant. Now, in terms of other variants, there have been other variants identified in Wisconsin. One is called B1351, and the other variant is called P1. And right now, these variants have not been identified in Rock County. So just that B117 variant. And as I said earlier, the main tools that we have to fight and prevent the spread of this variant are the same tools that we have to prevent the spread of COVID in general. So if you're able to get vaccinated, please get vaccinated. Continue to wear your mask, especially when you're in public places, and continue social distancing, and we'll be able to hopefully prevent ongoing spread of the coronavirus and also this B117 variant. So that is my updates for today. I'm going to pass it back over to Jessica.
Great, thanks, Nick. So I'm going to talk a little bit today about the new vaccine eligibility that's coming up on Monday, and some information about how to request a vaccine and get vaccinated. So first, I want to start with some exciting information. Wisconsin is currently first in the nation in the percentage of distributed vaccines administered. So the percentage of vaccine that we're receiving that's being put into arms. We do have over 1 million people in Wisconsin who have completed their COVID-19 vaccine series and are fully vaccinated against the disease. And Wisconsin is fourth nationally for the number of doses administered per 100,000 people age 64 and older. And I just want to give everyone a reminder that when we talk about people being fully vaccinated, it's referring to people who have received either one dose of the Johnson & Johnson or 2 doses of the Pfizer or Moderna vaccine, and have had 2 weeks pass since they've received the vaccine. So that full protection doesn't take place until 2 weeks after you complete your vaccination series. As I mentioned, we have some new vaccine eligibility coming up on Monday. Earlier this week, Governor Evers announced that everyone age 16 and older will be eligible in Wisconsin for the COVID-19 vaccine. This new eligibility is very beneficial to our vaccine efforts, and it will certainly aid in our efforts to contain the spread of COVID-19. Wisconsin currently leads the nation in getting available shots in arms, as I mentioned, and the vaccine supply and vaccination rates have been steadily increasing. We do anticipate that this will continue. Vaccine providers will still be prioritizing the previously eligible groups. So there may still be some wait lists, but this will continue to improve as more vaccine becomes available. I just want to note also that the Pfizer vaccine is currently the only one that is authorized for use in people age 16 and 17. So the Moderna and the Johnson & Johnson vaccines are only authorized for use in people who are age 18 and older. So if you are 16 or 17 years old, you would want to make sure that you're receiving the Pfizer vaccine. Vaccine providers don't always know very far in advance which vaccine that they'll be receiving. So it's important to communicate as early as possible in your registration or scheduling process that you do have that need for the Pfizer vaccine, so that they can either let you know that they don't have that vaccine or make sure that they have that available for you. We are making great progress with our vaccination efforts, but as Nick mentioned, it's still important to continue with the prevention measures until more of our community has a chance to be vaccinated and we know a little bit more about these variant strains that are circulating. We have heard from people that there are some questions about whether or not you need to be vaccinated if you've already had COVID-19. If you have already had COVID-19, you are still encouraged to get vaccinated. If you currently have COVID-19, you should wait until you have recovered from the disease. If you have received any of the treatments like the monoclonal antibodies, which is also called the BAM infusion, or the convalescent plasma, you do need to wait 90 days before your vaccine. So if you have any questions on that, we encourage you to reach out to your regular healthcare provider if you have one, or there are some ways that I will mention shortly for how you can get information about the COVID vaccine. We do know that natural immunity varies from person to person, so it's not known how long your immunity lasts when you have COVID-19 and recover from it. So we're not entirely sure at this point how long that natural immunity will protect you. There is some evidence that natural immunity from the original virus may not provide much protection from some of the other variants. If you're looking to get an appointment for a COVID vaccine, we do have some exciting news. Just today, the United Way launched a new website called rockcountyshot.com. You can go to that website to find local information about the vaccine all in one place. This is a one-stop shop for vaccination information. The site provides clear, easy answers to the most frequently asked questions about getting the COVID-19 vaccine, including eligibility, safety, cost, provider details, and instructions on how to register for an appointment. They have had participation from various providers throughout the community in collaborating and creating this website. So all of the major healthcare providers were involved and have their information on that website. They've also had participation from local pharmacies, national pharmacy chains, and the Rock County Public Health Department. If you're not able to access that resource online, you can always call the Rock County Vaccine Hotline at 608-352-6727, and they are there to help you get registered for the COVID vaccine. And as I mentioned, there is a resource that you can access to get information, just general information about the vaccine, and that is sponsored by Department of Health Services. And I apologize, I just lost that phone number. Nick, if you have that handy, otherwise, I'm so sorry, I just had it here and I lost it.
Are we talking for the state registry?
Yes, and I just found it, sorry. It's
Okay.
844-684-1064. So that number is available for any general COVID-19 vaccine questions. All right, and that is the end of my information. So we will now open it up to questions from the media. It looks like we do only have one participant today, and that is Ashley McCallum from Janesville Gazette. So I will now pass it over to Ashley. You can go ahead and ask your question, Ashley.
Hi, everyone. My first more pressing question today, as you had mentioned, we have about 75% of our 65 and older population in Rock County that has received at least one dose of vaccine and is on their way to being fully immunized. And as we look at the data, those folks in those age groups, those increases are starting to slow down a little bit. Do you anticipate I guess any outreach for getting to the rest of the 75 and older population? And do you think that's slowing down because of hesitancy, or because we know that some of the older folks in our community might have access issues like transportation, lack of internet access, or things like that? I guess what can you all do with the vaccine advisory group or the county health department to make sure we're reaching all of our 65 and older population?
Yeah, I can field that one. In terms of the percent of the 65 and older population that has been vaccinated, it's great to see that we have about 3/4 of our 65 and older population who have gotten at least that first dose. And we are continuing to work to get as many people who want to be vaccinated the opportunity to be vaccinated. Currently, the Rock County Vaccine Advisory Committee, that is kind of the group that is spearheading some of these access issues, is working on trying to improve transportation efforts and make transportation available to those who don't have transportation to get to a clinic site to be vaccinated. And in terms of some of these homebound populations, there are also efforts ongoing to increase access to homebound populations, people who can't get outside of their house to get vaccine. So there has been a pretty significant effort in Beloit, and we're working to expand that effort to the rest of Rock County to make sure that we are targeting the homebound population. And just want to continue pushing out the messaging to our 65 and older population. Although, you know, by next week, we're going to have a lot more people who are eligible for the vaccine. If you still want to get the vaccine, you can always get the vaccine. It's never too late to be vaccinated. And if you have any questions, if you don't have internet access, you can always contact us at the health department at 608-352-6727 for our Rock County vaccine hotline. And you know, we're continuing to look at these issues and try to address any issues that come up to try to get as many people vaccinated as possible.
Okay, thank you. And Ashley, we still have you unmuted, so if you have another question, you can go ahead.
No, I think actually I'm good with that. I had one other, but it was actually addressed in your presentation. So I think I'm okay for the day.
Okay, great. So today's media briefing will be short then, and we will conclude. I want to thank Ashley for participating in this briefing with us, and thank everybody who's been watching us on our Facebook live stream. Just a reminder that these media briefings take place every Thursday at 11 a.m. They are live streamed and the recordings are available afterwards on our Facebook page and YouTube channel. If you are a member of the media and you would like to participate in future media briefings, you can send an email to media.publichealth@co.rock.wi.us, and we will provide you with the instructions on how to participate in these briefings. So thank you, everyone. Be safe and be healthy.